Hi, good morning, everyone. I am Rahul Nanuhal, COO at Cureka.com, and we are here with you again on our weekly Instagram live session with a specialist doctor to take care of your concerns. Cureka.com is your go-to healthcare platform for all your daily healthy living needs. We have got products in 9 categories covering over 500 national and international brands of great repute, which are handpicked by specialist doctors. These brands have been proven to be effective for any healthcare needs. You can also consult with our experts for free on the WhatsApp platform, which is there on Cureka.com. We have recently opened another store at 12th Main Indranagar, and this store will help you to get all your daily healthcare needs by visiting directly. A great customer experience is waiting for you. So please do walk into Cureka's 12th Main Indranagar store to get what you want if you are in Bangalore. Also, if you have got relatives or friends who stay near Indranagar, please do let them know, and they will be able to collect the parcels or the gifts that you send them on Cureka.com physically. So it's an omni-channel platform. You can order online, collect it offline, or you can order offline on the store, and we'll get the products delivered to your near and dear ones across India. No need to worry about it. So I am your host for the day, Rahul Nanuhal, and we will be having a very special guest with us tonight, Dr. Shanmuga Priya. Dr. Shanmuga Priya is a very well-known aesthetic dermatologist, and she has taken care of many facial surgeries and has provided her consultation to who's who of Tamil Nadu. She has got a huge experience in aesthetic dermatology, and she will be covering the topic of hair fall control today. Hair fall, as we all know, is a very general topic. A lot of people face issues with hair fall. We have all been victim of hair fall across different moments in our life due to different reasons. For me, it might be, using of a lot of, I would say, gels or hair creams, which, initially got me into trouble for hair fall, and then, tension or anything, that can also help you. For ladies who are expecting, for them also hair fall would be something that would be a big issue. So here we are with our Dr. Shanmuga Priya. Welcome, and thank you so much for joining us today.
Yes, hello, good morning.
Yeah, thank you so much, doctor. Now, doctor, we are going to cover a very important topic today, hair fall, and you're going to help us with understanding how we can control hair fall. So let's move on to the first question. What are the signs of hair fall, and how can someone identify them?
Oh, so hair fall, some people will have like lot of hair shedding. They'll feel that when they wash their hair, the amount of hair that falls is more than usual. And some might see that hairs everywhere. People sometimes bring us hairs also. They say that they see hairs everywhere in their house. Okay, and then some may not have that prominent hair fall, but then they'll appreciate that the scalp is more visible than before. The cover they had with hair is thinning, so they have more of a scalp visibility. Some also say that the texture of hair is changing, like it's very thin, it breaks easily. So there are many signs. Most common is hair fall, but there could also be a less hair fall and more of thinning and scalp visibility. So that also we ask, like if they have more scalp visibility than before. And then
Right.
other signs like irritation, itching of scalp can also be there for some.
Right, right. Right. And how much hair fall is considered normal, doctor? And when should we be concerned about the hair fall?
The normal hair falls can be about 50 to 100 hairs per day. So that is normal. Most of the time we do not appreciate it because some comes when we comb our hair, some on our clothes, like we don't appreciate it much. Usually when patient starts to notice the it is more, that means that it has crossed that limit, daily limit. But for some, even with regular hair shedding, they get more worried. Especially for females, when they wash females who have long hair. For them, if they wash the hair like very infrequently, like twice a week or once a week, the hair which is supposed to fall every day, still comes out from the shaft, but it does not fall down. It's there on the scalp. Only when they wash their hair, that once a week it comes off. So some people mistakenly take that for increased shedding. That is not increased shedding, that is normal shedding, but that is accumulated in the scalp and it is coming out only when you wash your hair. This is mainly seen in people with long hairs. For short hair, usually it goes off daily. Shedding is there daily.
Right, right. And can hair fall be genetic, doctor? And is there anything that someone can do to prevent it?
Yes, definitely. Hair fall, most important factor for hair fall is genetic. It is more for males, especially like men. The genetic thing is more influenced. This what they have will be influenced by genetics more in men. Women, like genetics, other than the hair texture and the type they are born with, hair fall and hair thinning in women is less common than in males. So still genetics plays a role in both. So the first question most probably we ask when people come for hair fall is like how is the family on both sides, on mother and father side, because genes skip, so not everybody in your family need not have the balding. Even if some people have that, the trait can get skipped between generations and it can come.
Understood. Understood. Okay. And, then people ask us a lot of questions around how can someone differentiate between hair fall and like hair thinning?
Yeah, hair fall is like what you appreciate when you comb your hair, when you wash your hair, the amount of hair when you just even put your fingers through your hair, you feel that more hair is coming out. Thinning may or may not be associated with hair fall. Some people can have both hair fall and hair thinning, but there are people who have only thinning. They do not have that much hair fall. That is very gradually the hair texture starts to thin, so they notice it like when you notice it, that then that process must have gone for at least few years. People
Oh,
without
oh my.
shedding and only thinning, that is. With shedding, the change is like bit more drastic. Within few months, they'll appreciate that the scalp is visible more. For people
Yeah.
who do not have hair fall but only hair thinning, the process is very gradual. This is also more seen in men. Sometimes they do not have hair shedding. They come by 25 years and they say that I didn't have any problem. Suddenly my hair is very thin now. I mean, the balding is very obvious now, but definitely the process would have gone for at least 2 to 3 years when they
Yeah.
see that scalp visibility.
Okay, does age play a role in hair fall, or can someone experience hair fall at a very young age?
Now it happens because the genetic trait previously it used to be expressed late. By late 20s and early 30s, usually men used to start having baldness. But now it is not that, because even though the genetic trait is the main thing, the other lifestyle factors, environmental factors also affect the hair. So, some people have started. So, if they have a strong family trait, with each generation, the age they manifest that baldness is going with. I mean, like they
Down.
are more younger.
Yeah.
They are manifesting that
Yeah.
baldness more younger. So they say my father has baldness, but he developed baldness by only about 35 or 40. During wedding and all, it was normal. But for me, I'm only 21. Still, I've started the baldness has started for me. It is there now because in addition to genetics, there are also other lifestyle factors, the diet we have, the environment, everything else also influences. So we are seeing this baldness in very young age also. And in women, the thing is when they have nutritional deficiencies, when the diet requirements it's not adequately met, and when they go through this pubertal changes and everything, so by teenagers, women in teenage, we see lots of hair fall. When they have increased need for iron and other calcium and everything, but they are not taking it enough with all that hormonal and growth changes they are undergoing. So that when there is that mismatch, then we see some hair shedding in that age also.
Right. Understood. So we have a question coming in from a listener, Mr. Mohan. He says that is hair transplantation safer? His age is 35.
Pattern will safer.
Yeah, he's
Hair
asking if hair
transplant
transplantation.
done with a skilled person like a plastic surgeon or a dermatologist trained in hair transplant surgery is definitely safe. So no question about that. It all
Okay.
depends on whether you are a candidate for hair transplant. So that depends on your genetics, your grade of baldness, and the rapidity and the progressiveness of your baldness. Whether you have reached a stage where there is some stability in your hair fall, or you're continuously the baldness is increased by 35, mostly it will be stabilized. So early 20s
Okay.
the hair transplant even though it's done sometimes it may not be
Yeah.
ideal, so we have to wait for some kind of stability of their baldness before going for hair transplant. But by 30 or something, most probably this baldness everything would have stabilized. So hair
Okay.
transplant done with the person who has trained, not because many a times it is done by technicians who previously were assisting surgeons. They go and do it separately, and other commercial centers. That's best to avoid them. Even though they do give lower prices, it is best to go with a plastic surgeon or dermatologist trained in hair transplant. Then it is definitely safe.
Okay. Okay. And then we have a question from Mr. Pandi, and Pandi says that I have a red patch itching problem. Can you please tell me about this problem?
Yeah, so itching and redness on scalp, it could be because of two things. One would be what is commonly called as dandruff. So that is a common term. When there is just dry flaking, we call it as dandruff, but it is actually a condition called seborrheic dermatitis. So it can also come with redness, itching, and kind of irritation. So that can be present all over scalp, also sometimes on the back and chest, they have some kind of pimples like thing. So this is one cause, dandruff, which is more severe than the normal. So that is seborrheic
Okay.
dermatitis, where they can have this redness. And then the other thing would be a psoriasis type of thing limited to scalp. So they have scalp psoriasis that can also have this redness and itching. So we have to differentiate between these two before we go for treatment. For one end
Okay.
dandruff,
Okay.
we'll just use dandruff shampoos and such, but for other, we'll need more intensive treatment.
Understood. Understood. So, doctor, can certain hairstyles or hair treatments can cause hair fall?
Yes, hairstyle. We do have a condition called traction alopecia. So that means like if you put constant pull on your hair in the one direction continuously, then the hair roots do get weak and damaged. Then it can come out prematurely than it is supposed to. It can come out earlier than it is usual. So that for that we do avoid. That is not for all. Some people are more sensitive to traction. But universally, it is best to avoid very tight ponytails and very tight plaits kept for a long time. So even with people with long hair, they have to let free their hair for some time.
Right. So we have a question coming in from one of our listeners, Nishant. He says, I wear a helmet for long hours. How to control hair fall? I'm working in marketing field, age 25 male.
Okay. So the thing is, helmet alone, the occlusion is definitely there. They have a lot of sweating and that occludes this thing. So there can be some scalp inflammation, and if they have dandruff or something, that can get slightly aggravated with this. All the sweating and friction can aggravate it, and also friction can also cause some kind of like how we have traction in females with type things. Here the friction causes some amount, but that being the
Okay.
sole cause for hair fall is usually rare. They definitely usually have other factors, especially if they are males, then they have some amount of hormonal thinning, or they have some nutritional defects which can also be addressed. So obviously you can keep a layer of cotton cloth or something in between to avoid your sweating. Staying on there. So there's something to absorbent you can keep to absorb your sweat to reduce
Yeah.
friction and stuff. But then definitely we have to address other factors also. It is better to get assessed for all factors of hair fall and not just attribute it to only this occlusion of helmet.
Understood.
Have a
So,
good
doctor,
diet and more of good water intake, that would also help.
yeah, moisturizing yourself, like hydrating yourself. I mean, more
Yeah.
in that sense. Correct. Right. Right. So, doctor, a lot of times people ask questions like, can hair fall be a symptom of an underlying health condition?
Yes, definitely. Because many nutritional deficiencies, hormonal imbalances, and also other general illnesses can definitely provoke hair fall. Because hair, the supportive tissue around hair is something like a sensitive structure. It can be influenced by many things. And also,
Okay.
when people otherwise they could be nutritionally adequate. But for us, if you consider body health as a whole, for a human being, the hair, there's a need for hair is secondary to other vital organs. So, in body's point of view, hair is just an accessory organ. So, in case if they have slight deficiencies, the first thing that is going to get affected is will be hair, because it is going to divert all the nutrients to more necessary things. So there is this theory with hair fall that even clinically adequate levels, like people who have normal hemoglobin, and even then they have some kind of, that's why we see ferritin and iron studies more. Then we do not rely only on hemoglobin for hair fall. So even what I'm saying is, even with the person with a normal diet who seems nutritionally adequate, still they might have hair fall because the nutrition is not sufficient to
There are
provide for hair. It is sufficient for the other systems, but it's not sufficient for hair. So nutritional deficiency can affect. Then similarly have hormonal imbalances, more commonly PCOS, which is very common now, and other
okay.
diabetes, insulin resistance, everything can cause premature shedding of hair.
Understood. Understood. And can hair fall be as a side effect from taking any medication? And if that is the case, then what can somebody do about it?
Yeah, some medications do cause, because common we see is chemotherapeutic drugs. But with chemotherapeutic drugs, when they stop the drugs, the definite hair comes back, because it is a different kind of shedding. Where usually when the hair sheds from a shedding phase. The hair has few phases where it grows for some time, then it is rest for some time, and then it falls. So hair falling is natural. That cyclically it happens. So, but chemotherapy drugs causing, that is cancer drugs causing hair fall, usually sheds directly from the growth phase. So, so there is a very very intense shedding. But then when we stop the drugs, the hair grows back. So you need not very much. But some drugs can cause this chronic shedding. Some antidepressant drugs and some drugs can cause some kind of low level shedding continuously. Even for
Yeah.
them, nutritional supplementation, and there are some supportive serums which can anchor this hair more and lessen the shedding. So they can
Right.
go for that along with therapy. If the therapy, the original therapy is something which cannot be interrupted, if they are supposed to be on that, then we can go for some anchoring growth supportive serums.
Right. Right. So, typically people do use certain types of nutritional supplements, multivitamins, minerals, or any medications to help them overcome this hair fall. So are there any nutritional supplements that can help us to overcome hair fall?
Yeah, there are supplements, but the supplements better not to go for only biotin, because biotin has become like very famous. It has been associated with yeah, biotin definitely has a role in hair growth, but it is not the only vitamin which is going to influence everything. And also, actually, biotin deficiency is bit rare compared to other deficiencies. So, because the requirement as such is very less. So, so instead of, because many people say like I take biotin 5 mg, 10 mg, I take those tablets, but it's better to go for a multivitamin supplements with multiple vitamins in a balanced thing, and also other antioxidants and plant extracts. So it is better to go for that. And then, and it is always best if you are going to follow it with an nutritionally rich diet, because you cannot rely on supplements always. Supplement is to tide through that path where we have like hair fall. But to maintain
Right.
it, then we need a good nutritious diet to get all these nutrients naturally.
Understood. Understood, doctor. Right. So we have got a question coming in from a listener who says, "Hi, ma'am. How to avoid split ends? And I use protein shampoo and conditioner. I get itchiness if I didn't wash my scalp every alternate days. Please give me a solution." And this is Mr. Arun, and his age is 28. He's male.
Okay. So, split ends, there are external factors causing it and there are internal factors causing it. So, external factors is weathering, like when exposed to harsh sunlight, hair treatments, chemical treatments, bleaching, coloring, and all these things, they can damage the protective cuticle of your hair. So, all this always, when the hair is wet, the cuticle is very vulnerable. So if they frequently wash their hair with very harsh shampoos, or if there is like sweat exposure, swimming, water exposure continuously, or other elements like high humidity and environmental stuff. So most basically when we are exposing our hair to elements, and also when we are using it other hair treatments like salon treatments, then hair, the cuticle can get damaged. So that is one cause for split ends. So that kind of approach will be better if they use, if they lessen all these causative factors, and then they go for more gentler shampoos and following shampooing with conditioners, and then after wash they can go for serums which can coat hair, so that there is less static between hair and the hair do not get rubbed and more split. Okay, they can go for static reducing silicone serum. This is one approach. The next would be internal factors, because hair is more than 90% protein. It's keratin. So protein shampoos, they do not integrate into hair to supplement the protein. They just coat the hair with layers so that it is less exposed to the external elements. But the protein intake is one thing which is going to correct your building of the hair. So hair, when it develops, when it should be strongly built, then we should go for internal protein intake more. So we have to address both sides. So either intake wise they have to have good protein intake, and externally they can go for serums which can coat their hairs.
Understood. Okay. Right. So we've got a question coming in from Karthik. He says, "My son is 17 years old. He got hair fall now. He's completed 12th class. He's got viral fever in November. After that, his health is very weak. Can I give biotin gummy to him or any natural food as a consideration, doctor?"
Yeah, that's what I said. Because after illness, there is bound to be some nutritional deficiencies which can happen, because there is much diversion. A lot of being used for your healing thing. So it is best to go for a multivitamin rather than a single biotin supplement. So that mostly will not help. So you can go for multivitamin supplement directed for hair. And nutrition wise, you can go for multiple colored fruits and vegetables, so that you get a mix of all kind of vitamins And then you can concentrate also on protein intake in the form of like lentils, pulses, and also meat if if they can eat it, eggs. So we have to cover all these bases. And we have to give some time for it to reflect on our hair. We do not expect something we take a biotin today or supplement today and the next day the hair should not fall. So that is unrealistic. You have to give about 2 to 3 months time for everything to work. So you have to follow whatever you're taking, the supplements and diet, you have to follow it for at least 3 months.
Understood. Correct. Right. Right. So, doctor, now can using a hairbrush or a comb can cause hair fall, and then how can we avoid it?
Yeah, sometimes hair brushes can cause because some brushes, especially regular plastic brushes, the finish of the brush is like there is small spikes on its ends. It is not visible very much, but then that can tear your hair, especially when you are doing it with the semi-damp hair. It is when it's very vulnerable. So some brushes, especially with very close set teeth of the combs and very low quality plastic combs where they have like extra, the finish of it is not very smooth. So then it can definitely traumatize your hair. Can go for handmade plastic combs or metal or combs. So that is better for detangling your hair, and also can use some serums to detangle. Or
Okay.
otherwise even just some oils, just not apply it more on scalp, they can apply more on the hair for detangling. And then you can use it detangling, then comb. Don't use this
Right.
close set narrow combs for detangling.
Understood. Right. So we've got last question for the day coming in from Miss Bhuvneshwari. She says, "I'm working in the IT field. I have hair fall. What is the best supplement to control hair fall? My age is 36. I'm female."
Yeah.
So can we look at certain ingredients or something that can be there in our food or diet, doctor?
Yeah, so all B vitamins definitely, and then we definitely also have biotin, and also on minerals, not just vitamins. We also concentrate on minerals like zinc, calcium, and iron. So
Yeah.
multivitamin supplements sometimes will not have optimal levels of iron and vitamin D because these two things are something which are given in lower range in multivitamin supplements. So if they can take a multivitamin supplement but still they have hair fall, it is better to check for an iron level and also vitamin D level separately because these two things, if they are normal, it is not wise to supplement without checking. It's not like B vitamins. B vitamins are water soluble. So even if you have adequate levels and you take a vitamin, it's not going to harm you in any way. What is excess will go just get excreted. That's all. But it's not the same with other some minerals like iron and also like vitamin D, which can get stored in excess. So excess of it is not good. So we have to check for iron and so we have to check for iron and vitamin D preferably, still if you have hair fall, and then supplement accordingly to that. So that supplements, it's better to check and add accordingly. Then that would be a complete thing, all these supplements. Diet wise also you can concentrate on iron rich diet like vegetable leafy things and dry fruits and such.
Right. So thank you so much, doctor. You've given us a lot of insight on what food supplements, what diets are important to control hair fall. I'm sure a lot of guests would have understood that and then taken your advice. Guys, one more thing, Health ETC is coming up with their specialist hair health gummies. You can use them as well. They'll be out in the next 2 weeks. And you can use these gummies, which are great combination of all nutritional supplements required for healthy hair growth. Anyone who is having hair fall or anyone who wants to have a thick, lustrous hair can use Healthy TC Hair Health Gummy. With this, I would like to thank Dr. Shanmuga Priya for joining us today. And it has been a great, talk show throughout, as always. So thank you so much, Dr. Shanmuga Priya, and we look forward to connecting with you again.
Okay. Yeah, thanks.
Thanks. Take care.